When Doran told me about the SpeedFlex program and how at the beginning he would go in and it was one-on-one training, and the staff was always there to make sure that he wouldn't fall, he wouldn't hurt himself. They would push him, but they were number one primary concern was for his safety. So I always have felt comfortable that he was in excellent hands. I never worried that he would become injured or have an accident that would have repercussions, a setback physically to where he couldn't work out. The staff with SpeedFlex, they push him, but the bottom line is they're always there to watch him. But I think the biggest compliment to the staff is that they allow him to work out in groups, and he feels like one of the general population. He doesn't feel like the Parkinson's patient. He feels like he's in with a group of athletes, that he's working out, that he's just part of the group, and he doesn't feel like he's the guinea pig, that he's the poor guy with Parkinson's. You know, he'll say, well, guess who I worked out with today? And I'll say, well, who'd you work out with? I worked out with the Secret Service. Yeah, I was keeping up with them. And, you know, to know what that helps him mentally, to have that little ego boost that he can hang with the big dogs. You know, he will admit there's a couple things that he has problems with. He said, you know, I didn't do very well with jumping jacks today. And I said, well, okay, but you handled everything else well, didn't you? Oh, yeah, I was awesome today. If you have someone who is motivated or even willing to try, I think the staff is so encouraging. Even if you're not an exercise person, you're not a person that likes to work out in the traditional sense. If you feel that you want something to help other than just taking a pill, I wholeheartedly encourage you to try it. I mean, it has made such a difference in our life, and I feel sorry that this is a program that's available. People don't know about it. I wish I could stand on top of a building and say, if you have Parkinson's disease, try SpeedFlex, because until that came into our life, we really didn't see a silver lining. We didn't have the hope, and we were not seeing the results that we do now with just medication. It's just been truly amazing. And I think we have something that works. I think this SpeedFlex program is something that can definitely make an impact on people. It's made my life easier. Before, Doran did not want to really go out, socialize, do anything after work. He was exhausted. He didn't feel well. On the weekends, he didn't have much energy. You know, now I say, hey, let's go out to dinner with another couple. He's like, okay, what time? Are jeans, can I wear jeans? You know, that's the biggest thing. Well, can I wear my jeans? But it's really made a difference in my life. I think that it can really make a difference in everyone's life, that if they're just willing to give it a try. And as a caregiver, of course, you know, I want what's best for Doran. But we're a couple. I mean, everything that affects him affects me. And anything that makes his life easier, that makes his health better, makes my life better, makes my health better, mental health. So, you know, I'm encouraged. I'm more optimistic. I have hope.